Welcome, everyone. My name is Lori Thompson. I am from ESD 113. I am the director of the Capital STEM Alliance, and in collaboration with the Timberland Regional Library, this is the fourth in the series of Moving Forward Together. This is a semi-annual, so twice a year, Zoom meeting around social emotional topics that affect people in our region. And before we get started, I would like to remind everyone that if you'd like to see the prior three Moving Forward Together episodes, they are all available on the Timberland Regional Library website as podcasts. Is on YouTube, on their YouTube channel.
Right.
On their YouTube channel. So feel free to go into the Timberland Regional Library website and get into their YouTube channel, and you can find these archived. And they're also on the ESD 113 YouTube channel as well. So again, welcome. I'm Lori Thompson from ESD 113. And tonight's topic on Moving Forward Together is on loneliness and social isolation in our region. So without further ado, I would like to introduce, we have quite a lineup today. We have a wonderful keynote speaker, and we have a group of 4 panelists who are going to be answering our questions about social isolation and loneliness. And to get started, we're going to jump right into our keynote. I'd like to welcome Elizabeth Hawkins from the Thurston County Public Health Department. Elizabeth is the Parent-Child Health and Education Outreach Specialist. Elizabeth, I'm going to turn it over to you.
Perfect. Thank you so much. I am just going to share my screen so you guys have a graphic to look at while I'm talking. So give me just a second to do that.
While Elizabeth is getting ready, let me remind you that if you have any questions in the audience, or you have comments, or you'd like some more information, or you want to say something, please enter it into the chat, and we'll be monitoring that throughout the evening. Thank you.
Perfect. Okay, so can everyone see my screen? Perfect. Okay, awesome. Well, I'm Elizabeth, and a lot of my work is focused on promoting mental health and well-being for all community members, which is why today I'm going to be talking about social isolation and loneliness. In 2023, the Surgeon General released an advisory to call attention to the importance of social connection for our health and well-being, and how social isolation and loneliness is an urgent public health issue. So, what is social isolation and loneliness? Well, social isolation occurs when individuals have limited or no meaningful social interactions, leading to feelings of loneliness or exclusion. Someone who is socially isolated objectively does not have many connections to other people. It affects people across all ages and backgrounds, with serious consequences for mental and physical health. Loneliness is a state of mind where individuals perceive isolation or inadequate, meaningful connections. So, someone who is lonely can still have many connections to other people and appear well supported. In a recent study, it was actually found that people between the ages of 30 and 44 were the loneliest group. 29% of these people in this age range said that they were frequently or always lonely. Among 18 to 29-year-olds, the rate of loneliness was 24%. And surprisingly, adults age 65 and older reported the lowest rate at 10%. So, why do we want to address social isolation and loneliness? There are 2 reasons. Well, there are lots, but one of the reasons is health risks. So, there is an increased risk of depression, anxiety, dementia, and cognitive decline. But not only that, there are physical health impacts such as heart disease, type 2 diabetes, high blood pressure, weakened immune systems, which make individuals more vulnerable to infections. So, for example, lacking social connection can increase the risk of premature death as much as smoking up to 15 cigarettes a day. The second reason, community well-being. So a connected community is healthier, safer, more resilient. Social connections are vital in sustaining individual well-being and community resilience. nurturing physical and mental health, and just overall prosperity. Individuals without social connections outside the workplace have actually cost more than $154 billion a year and lost productivity due to people being absent because loneliness hinders people's ability to do their job. Now I kind of want to talk about the signs of social isolation. So this could be withdrawing from social interactions or activities that were once enjoyable, frequently canceling plans with friends or family, experiencing anxiety or panic when thinking about social interactions, feeling distressed during periods of solitude, lack of support systems or someone to turn into times of need, and lastly, difficulty accessing community resources due to physical, mental, or financial barriers. Um, so what are the causes of social isolation? This list is not exhaustive, but a few are intimate partner violence, the loss of a loved one, mental health challenges, living in really remote locations, overusing social media, being unemployed, or having a physical disability. A lot of the causes of social isolation are also the causes of loneliness. So this could be, again, losing a loved one, changing a job, moving to a new area without a support system in place, becoming a parent, and experiencing mental health challenges. And we should remember that social isolation and loneliness can often be intertwined. So the causes of social isolation can also be the cause of loneliness. But as I said before, people may feel lonely and not feel socially isolated. So who's impacted? Um, this could be single parents or caregivers. They may not be able to see their friends or take time outside of the house because they don't have any relief coverage. Nearly 65% of parents and guardians in the US are classified as lonely compared to 55% of individuals with no children. Another one is belonging to a minority group while living in an area where there are not too many people with a similar background. Being low income. Low income individuals can't always participate in activities within the community if they are not free. 63% of individuals in the US who earn less than $50,000 per year are lonelier than those with higher incomes. Lastly, young adults. Again, this is on a US basis. 79% of young adults experience loneliness at higher rates than seniors age 66 and older at 41%. Okay. And I really want to talk about some strategies to combat social isolation and loneliness. And we could look at this on an individual level. So this could be reaching out to neighbors, friends, and family on a regular basis, volunteering in community programs to build meaningful connections, engaging in local events, groups, or clubs that align with personal interests. For me, I have actually started taking a ballet class at the Olympia Parks and Rec Center. This has allowed me to meet new people and make new connections, and it really has made me feel less lonely and more socially connected within my community. And lastly is reducing technology and social media use. So researchers are finding that many online users are not able to turn their online interactions into real social relationships, which leave many to feel really socially isolated. And then another strategy on a community effort level would be hosting inclusive events or programs that encourage participation from all community members. So, this could be creating gardening workshops or starting a neighborhood cleanup. That anyone can join, creating public spaces that facilitate casual interaction. So, this could be at the park, the library, or community centers. And then advocating for accessible resources for those isolated populations. And today, Thurston County, we actually declared social isolation and loneliness as a public health issue. And along with that, we have created a social media campaign that will start in January of 2025. And we have created a webpage that will have information for the community on how to combat social isolation and loneliness and how to find support. And then you will also hear from our panelists just about the additional resources, that we have within the community who are experiencing social isolation and loneliness, and how we can all work together. And uh, just kind of in closing, so how we can help. So on an individual level, this could be committing to making one connection this week. So reach out to someone who might be feeling isolated. For community members, this could be collaborating to create a welcoming environment in your neighborhood, like block parties, holiday celebrations, or even a potluck dinner. And then for organizations, this could be support or sponsor initiatives that reduce isolation and foster belonging. Small actions like saying hello to a neighbor or checking in on a friend can build meaningful connections that strengthen our sense of community. Even the smallest gestures can make someone feel valued and included. By reaching out to others, sharing a moment of kindness, or simply listening, we can take steps to reduce social isolation. Starting today, let's commit to creating a more connected and supportive community for everyone. Thank you.
Thank you so much, Elizabeth, for
Yeah,
sharing all of that. Very important data to have, and love the checklist of things that can be done to mitigate some of those issues around loneliness and social isolation.
thank you.
Okay, so now that we've had a great introduction to this topic, let's turn to our panelists. We are lucky to have 4 panelists here with us this evening. We have Dr. Jen Freiheit, who's the newly installed director at the Thurston Public Health and Social Services Department. We have Brian Windrope. He's the executive director at the Senior Services of South Sound. We have Zach Dares, who is the Director of Resource Development at United Way Thurston County. And we have Cheryl Haywood, the CEO of Timberland Regional Library, as our panelists. What I'm going to do is I'm going to be asking each of them a couple of questions. We're going to hear their expert advice around the topic of social isolation and loneliness. And if we have time, we will allow some questions from the audience as well. If you do have a question, please make sure you put it into the chat and I will go ahead and speak it for you. I read in Dr. Vivek Murthy, the Surgeon General's report, the advisory that's linked here. I read that 50% of adults in the US experience loneliness at some time or other. And I quote, he says, "We are called to build a movement to mend the social fabric of our nation. It will take all of us." So here are our panelists to explain how this can be done. I'm going to start with Dr. Jen Freiheit. Jen, welcome.
You.
Please tell us your role as the director of the Thurston County Public Health and Social Services Department, and what are some of the ways that you think your resources can help ease social isolation and loneliness?
Yes, thank you for having me. I'm very excited to see all the attendees. So thanks for taking the time this evening. As the Director of Public Health and Social Services, I oversee over 60 different programs and services that range from communicable disease control to our nurse family partnership program to developmental disabilities, veterans affairs, environmental health. We're the ones that inspect your restaurants, amongst many other things, pools, schools, all the rest. And treatment sales tax, the 0.1% that goes towards behavioral health. So we have the Office of Housing and Homeless Prevention. We have many, many programs and services that intersect with social isolation and loneliness. And so we have many programs and resources that can actually aid in this, of which are linked on the website as well too, the Thurston County website that is linked here. But I just want to highlight a couple of them that are newer or really reaching out for the purpose of this campaign that we are looking to end social isolation and prevent loneliness. And so first, just really briefly, I'll talk about our Nurse Family Partnership Program. This is where nurses, in short, are going into homes, and they are a long-term support for families with infants and children from pregnancy through the age of 2. And this provides a routine visit where it may be the only social outlet for clients. So they have this trusted support person that is helping them with many different aspects of behavioral health, clinical health, and social health. So that is one important resource that we have at the health department. We have a fetal infant mortality review and prevention program, which has in the recent years set up a bereavement support group and perinatal mental health support group. So it's really offering those outlets for connection for people in different phases of social isolation or loneliness, depending upon grief or whatever else they might be going through. We have an evidence-based program called Living Well, and these are cohort online interactive workshops for people with chronic pain, physical and mental health conditions, and their caregivers. Participants take the classes to reduce social isolation and loneliness, working together to manage their chronic diseases. We also have a lifestyle change program, which is a 16-week nutrition, weight, and lifestyle change program that benefits include feeling better physically, emotionally, decreasing stress, becoming more positive, having more energy, and connecting with the new friends of the program. So these are all recent developments that we've had in our program. And one longstanding program that I would be remiss to mention is that we are in charge of the special recreation program for Thurston County. Now, this started as programs for those 16, 18 and older with developmental disabilities, but we have full community inclusion. So often it's families and other families that are not intersecting with the developmental disability realm. And different things that we offer is throughout our developmental disability and special recreation program are individualized employment, healthy relationships, senior programs, arts and crafts programs, swim lessons, bowling, dances, all sorts of things to really end social isolation for that community in particular. So we have many, many different programs and services. The list goes on. They're all on the website, but those are some immediate ways that we are out there impacting social isolation and loneliness. Public health is natural for this because we are in all facets of public health. We often joke that what isn't public health? Nearly everything out there, is under the public health umbrella. And so it was a natural alliance when approached by United Way and YMCA and Senior Services for the South Sound and the library system to be able to partner on this endeavor because as it was mentioned, this is a collective impact strategy that we all need to work together. I really feel that coming out of the pandemic, look, there was isolation and loneliness before the pandemic, but certainly the pandemic exacerbated that. And for not just, certain populations all across the spectrum, as you heard in Elizabeth's presentation, it's not just one category of people that are experiencing this. And because public health touches all people across the lifespan, this is important that we're involved and help leading this effort as well too. So that is just a quick blurb. Thank you very much about public health and social services.
Thank you, Dr. Jen. Appreciate that. I'll probably have a follow-up question for you in a few moments.
Sounds good.
Let's ask Brian Windrope, the ED of the Senior Services of South Sound. Brian, what are some of the resources, supports, services that your organization offers around the South Sound for seniors who are experiencing loneliness or social isolation?
Thank you, Lori, and good evening to everybody. You choosing to be here tonight shows your interest in this topic, and I really appreciate that. When asking ourselves this question back in January of this last year, my organization, adopted a theme to our work this year to battle isolation and loneliness, which is a very unusual thing to do if you know nonprofits. We have our mission statement, right, and our values and strategic plans and all that stuff. But in my long career in nonprofits, I've never heard of one having a theme. But here we adopted the theme to do this. And so we asked ourselves the question of what do we do to help seniors? And the answer to that question is, honestly, everything we do is literally about helping seniors stay connected and avoiding being isolated and lonely. So most of you on this Zoom would know that we operate the Lacey Senior Center as well as the Olympia Senior Center. Those are gathering places for seniors for all sorts of things. And I like to emphasize that unlike most other nonprofits in town, many nonprofits exist to help communities that are struggling, and that's as they should. That's their work. Senior Services is a bit unusual in that we don't exist only to help struggling seniors. We also very much exist to help seniors who are thriving. And what I mean by that is that our mission statement is to improve the quality of life for people as they age. And so some of our programs help seniors who might be struggling, like Meals on Wheels. And the catchphrase of Meals on Wheels is that it's more than meals, right? Because it's volunteers who deliver the meals, and that's often the only human contact that people have if they're receiving Meals on Wheels is the person who delivers their meals. So really, I could go around our organization and say that every program we have in some way is getting seniors to have a better quality of life, whether they're struggling financially or struggling with physical ailments or just wanting to have a good time. Our Trips and Tours program takes seniors on trips all around Puget Sound and internationally. Our activities include, I was so delighted to hear Elizabeth taking a ballet class, by the way. Good kudos, Elizabeth. We have all sorts of classes, academic classes, fitness classes for seniors. And every day at the Olympia, Lacey, and Tenino, Rochester, and Shelton, we serve Mason County as well. We serve hot lunches. And the Surgeon General, by the way, after coming out with that report in 23, has continued to work very actively on this topic. There are a number of speeches he's given and conferences he's been a part of. He's really putting a lot of energy into this nationally. And there's a report that just came out a few months ago on the importance of eating together and the time-honored tradition, right, of breaking bread together. And I thought that was fascinating. So we serve hundreds of thousands of meals a year to seniors, hot meals, lunches in our various locations. Half of my staff is kitchen staff for that reason. So I could go on and on and on. It's really baked into the DNA of who we are as an organization, founded in 1973. To paraphrase our mission is to help seniors stay connected, get connected, be connected. I like to quote Kyle Cronk, YMCA executive director. He likes to say we're better together, and that's just a nice way to put it. We are certainly better together. And although I'm in charge of a senior serving organization, it is plain to me that this is an issue among all ages. I have two boys I've raised who are now young men, and I speak with them about this. And we know that this is a factor among all ages. I would only emphasize that with seniors, it's an interesting switch, right? Younger people tend to not be isolated, but they will be lonely. Among seniors, it's more likely that they will be isolated because of life happening the way it happens, right? You lose your spouse, you may or may not have kids, or they may live far away. So seniors, because of time, accident, and fate, end up being isolated and lonely, which is particular to that age group that I would like to emphasize and is of great concern to us. So thank you for the opportunity to speak about this. And I want to take this chance to just quickly to say enormous appreciation to Jen Freiheit with the Health Board and the Health Board today, taking this action to highlight this as a public health crisis in our county, because it surely is. And it shows incredible leadership by our public health department. And I think we all appreciate the importance of it. So thanks to them.
Yes, and what I learned today is that Thurston County is the first in the state to declare. Go Thurston.
Thank you so much. And thank you for that addition, Cheryl. It's very important. This is obviously a very important topic. And it's a very important issue that I think we've all suffered from at one time or another, or continue to suffer from. So yes, it's an extremely important topic, and we really appreciate any help that you can all give us. Thank you, Brian, for those suggestions. And let's talk to Zach. Zach Davis is the Director of Resource and Development at United Way Thurston County. Zach, what does United Way do? What are some of the programs that they offer, and how are they involved in data collection around social isolation and loneliness in Thurston County?
Absolutely. Well, one of the things that Elizabeth covered was talking about the financial stress and how that impacts loneliness and isolation. And with United Way, not every United Way does an ALICE report, but what ALICE reports are about those folks who are asset limited, income constrained, and employed. In fact, I'm going to share a link to that so folks can take a look at some point if they'd like. But this is basically an assessment of the working poor here in Thurston County and throughout the state of Washington. You can look at specifically those here in Thurston. And it's a much higher number than we would anticipate because the government sets the federal poverty guidelines at about $31,200, I think, for a year for a family of four. And there's no way you can live on that in Thurston County. So United Way's ALICE report takes into account things like insurance costs, actual cost of housing, and we see that number at about a third of our community year over year. So we give this update every couple of years, every 2 years. We're kind of behind on the data, just like every data report is. But we see about a third of our community here in Thurston is experiencing financial stress, is in that space where an unexpected bill could really set that household spiraling. And so for us, we took a step back. We thought about, how are we impacting the community? We put together a task force to really examine the sources of poverty. What is it that's causing? What are the pipelines here in Thurston County? And so we began to shape our new initiatives around those. The first one that we put together was our Navigators, High School Resource and Career Navigators program. And these are individuals who are serving in our area high schools. We have 7 of our 9 area high schools covered, I believe, and we're specific to Thurston County. And their job is to go in to build relationships with students that may not typically move on to a second post-secondary degree or certification. So really trying to build relationships with students and their families who wouldn't know that, it can make the difference to $750,000 to $1 million in earnings if you just get an X-ray tech certification or something as simple as that. So those navigators are in the high schools. They're building relationships, helping students navigate paperwork. English as a second language student, or a student whose folks didn't have a post-secondary degree or certification of some type. And that's who they're really targeting. We've seen some great success as the FAFSA rates have gone up locally. Another thing that we're doing in cooperation with SPSCC is bringing trades training here to town. So really thinking again, what are those roots of poverty? What are we missing? What from cradle to career? What are the gaps? And we realized that there isn't a ton of trades training here in Thurston. If you want to go to a trade school, you got to go up to Pierce County, and we're missing out. We're missing out on the money, and there's no one to hand businesses off to, as a lot of those folks who are involved with plumbing and electrical, et cetera, age out or seeking to retire. There's just not a workforce to replace them. So we're working with a number of partners to bring that here. We're also working to put together a hope-based initiative for workplaces. I know that we're also heavily involved with advocacy, and I'm stepping in for our executive director. And I know she can speak way more to the advocacy than I can. But I really see us at United Way of Thurston County being a convener, being a researcher, and being a spokes organization for this loneliness and isolation, and making movements at a systemic level to try to combat that.
Thank you so much. I do have a follow-up question for you. With the number of transitioning military families in Thurston County due to their proximity to the base, wondering if that contributes to that high number of the ALICE population, the working poor. Are those permanent residents, or are those transitory? And how often is the ALICE data collected?
The ALICE data is collected every year, and so we get an update.
Right.
It's 2 year. It lags by 2 years, but we get an update every year. I'm uncertain about how the impact of JBLM and workers there. I'm uncertain what the impact is, but it is an assessment of folks that just live in Thurston County, whether or not they're renting or owning a home, how long they've been here. It's an assessment of who's there during that count. Looking at economics surrounding a household, average earnings. The ALICE report itself has a lot of links to the disaggregated data, so you could go in there and if you really wanted to click around and examine which of the sources, which sources were used to collect that data. There's a lot of great information in there.
Thank you. And I want to give a plug to United Way, Thurston. I know that the financial literacy piece, the career navigators that you have at the Thurston County Schools are jointly funded by not only United Way, but also by SPSCC and the Chamber of Commerce and others. So kudos to you for all you do to help mitigate some of those issues of financial loneliness and social isolation as well.
Thank you, Laura.
Okay, and now let's talk to Cheryl Haywood, the CEO of Timberland Regional Library. Cheryl, I can't even begin to think of half, even a third of all the amazing programs that the library offers to address social isolation and loneliness in our entire region. Could you please highlight some of those resources that you have?
Yes, thank you, Lori. So I first want to start with Timberland Regional Library was founded by the people for the people in 1968 across this 5-county region, which has the same 5-county footprint as ESD 113, which is where Lori comes from with the Capital STEM Alliance, and with the local workforce development council called Pacific Mountain Workforce Development. Across the 5 counties, and the counties include Thurston, Lewis, Mason, Pacific, and Grace Harbor counties, so it's about 555,000 people. We have, you have access, each one of us, with a free library card because you live in the 5-county region for the most part. There's a few pockets that you may have to pay for a library card, but for the most part, the majority of people living in this region pay taxes to us, and if you pay taxes, you get a free library card. You have access to 29 libraries, and so your card is good at all the 29 libraries. And in Thurston County, there are 7 libraries. So there's one in Lacey, there's one in Hawks Prairie at 8205 Martin Way. There's another one, obviously downtown Olympia. There's one at Capitol Mall. There's one in Tenino, and there's one in Yelm. They all have staff. They all do a lot of programs, and I will be sharing with you momentarily the types of programs that the staff are putting on. In addition to that, there's one library in Thurston County. Sorry, I'm still getting over a cold. There's one library in Thurston County and 11 others spread across the 5-county region that offers what we call expanded access hours. So if you are 14 years of age and older, you can get a key card to enter the Tenino Library when the staff are not there. And those hours are from 7 a.m. to 8 p.m. daily, including Sundays and holidays. People have been requesting over the years early morning access hours to the library, evening hours, and Sunday hours. And we have a limited budget, just like other government entities. And so we introduced technology over the past 3 or 4 years since the pandemic to be able to offer expanded access hours. You can go to any library to get a key card. The staff there will explain to you how to use it and how to use the library when they are not there. And you're also able to bring in minors under 14. What you cannot do is bring in another friend who's over 14. Your friend would need to have a key card as well. Your key card is good at all 12 libraries. Same hours, 7 a.m. to 8 p.m. daily, including Sundays and holidays. So this has added, triple the number of hours that people have access in the rural communities to their library. And why is that important? Well, to access information, to apply for jobs, to hang out with other people, to access the meeting room after hours if that particular library has a meeting room, et cetera, et cetera. So I urge you to check out expanded access hours and to get a key card and to try it out. It's very, very popular. It's very popular in our, like for example, in Ocean Park in Pacific County. It's very popular in Hoodsport. Retired people really enjoy it. They're able to go in and read magazines and access the internet and meet up with others. And so just wanted to put a plug for expanded access hours. I do want to go back to what Brian was saying about the word connection, because we also have the word connection in our mission and vision. And our Board of Trustees has just adopted the new strategic direction for 2025 to 2029. So there's an updated mission and vision statement. The mission is we connect our diverse community to ideas, experiences, and each other. The vision is experience the world of ideas through TRL. Our welcoming spaces, diverse collections, vibrant partnerships, and engaged patrons reflect our commitment to creating an equitable future. We are a trusted community resource. So I want to talk now a little bit about the meeting room spaces. In our libraries, most of our libraries do have meeting rooms, and we do encourage community groups to reserve the space on a regular basis so that they can meet up with the people who support their community group. So there's a wide variety of community groups that reserve our meeting room, and it's free. We do not charge for it. So for those of us who are interested in whatever the topic is, you can go to your local library, talk to the staff there. You can figure out, community groups and what's going on there. From our website, trl.org, you can look at all the different types of programs that our staff put on. Each one of our staff who's responsible to put on programs is expected to put on 18 programs a month. So imagine that, there's tens, if not, there's a lot of people putting on programs, and you could see that at trl.org. At the website, you can see that there's virtual programs, there's in-person programs, and you can divide it up by county, and you can divide it up by age group as well, and also by topic. So there's lots of different ways that you can parse out that information. So I just did a quick scan yesterday. I wanted to share some of the virtual programs that we offer, and these are on a regular basis. There's a film club that's online that the Olympia staff put on. There are book clubs online and in person regularly throughout the district. We started earlier this year with best-selling New York Times authors, virtual author talks that you can join nationally to listen to these authors. There are story times that are virtual as well. We also have, of course, story times and all kinds of story times, preschool, baby, family, etc. in our libraries. We have a teen digital Dungeons and Dragons that goes on across the district. We have neurodivergent adult book club that is virtual, and we have a BIPOC book club that is also virtual. In person, and these are the ones that I'm looking at, the ones that I'm sharing with you right now are what's going on right now in Thurston County. Of course, there's a lot of information for the other 4 counties at the website. In person, there's all ages board game night. There's a gentle yoga at the Yelm Timberland Library. You can join the local Friends of the Library groups to help support your local library. There's a walking club out of the Yelm Timberland Library, and they walk around the town. There's a Readers Theater Unlimited at the Tumwater Library, and there's 2 short comedies that will be put on this week. There's book clubs also at all the libraries. The Lacey Library has a very, very successful weekly talk time English conversation circle, incredibly popular, especially for people whose first language is not English. And then in Olympia, this December 13th, there's live music. Lantern lights the library in the evening. For teens, there's a lot of art classes. It's called In Between Art Day at Olympia. There's a pizza chat in person at Tumwater for teenagers. There's a teen anime. There's a teen art market. There's a poetry post. There's an introduction to machine sewing. There's an introduction, there's also a game day for tweens. So there's just a lot of wide variety of artistic, literary, musical programs and book discussions and all kinds of enrichment classes that are in person or virtual with people in this county. And of course, you can still go to it if you're living in Mason, or if it's a virtual or in person in Thurston. You are welcome at any of the 29 libraries. So I think at this point, I'm going to put a stop to it because I can go on for the rest of the time, Lori, and I can add things further on.
Cheryl, I'm trying to keep up with you. It's very hard. There's one program that I'm so pleased to, and this ties right in with what Zach just mentioned about the working poor. For people in Thurston County or anywhere in our region who are socially isolated because they cannot find a job, or they want to change jobs, or they're unhappy in their job, you have a special place, a resource for people who are job hunting. Can you just say a couple of things about that?
Let me just say, like so like I mentioned before, the 5-county region, the local workforce development council is for short called Pack Mountain. And they have all these wonderful partners in this region trying to get people into family wage jobs. So one of the things that happened in 2016 is that all the libraries in Timberland became connection sites in the WorkSource system, so that we help people connect to either WorkSource services, or we connect people. We also help people, of course, with resume writing and digital literacy, et cetera, et cetera. So we're connection sites. We have a wide array of online resources to help people, get information about the job that they're going to go interview for, or help with resume writing, or their digital literacy skills. We have a lot of free online classes from LinkedIn Learning, or Universal Class, or North Star Digital Literacy. These are 3 of several more of online resources we offer for that kind of help and support. Starting in January, for the next 4 years, Pack Mountain, in addition to all its partners, including Timberland Regional Library, will be promoting a major marketing campaign for this region. It is called Opportunity Grows Here. And this is for people who are looking for family wage jobs in this region, that they will be trained up in apprenticeship or other types of work experiences, or they will be linked to the local colleges to go to school to get the accreditation to do the work. And so there's just, you'll be hearing and learning a lot about that in the future. So those are some of the ways that we offer assistance when it comes to workforce development.
Thank you so much for sharing that. I appreciate it. Dr. Jen, I have a follow-up question for you. You mentioned that Department of Public Health and Social Services has a huge variety of programs. If I'm a teenager and I'm kind of depressed, I'm having trouble with making friendships in school, how would you recommend I get started to access some of the programs and services that you offer at the Public Health Services?
Unfortunately, that's an area sort of lacking for public health and social services. We are so bound and driven by grant funding sources. And right now there isn't a dedicated line of funding for public health and social services for that age group, that population. So we would probably largely recommend going to the other partners that have spoken here today and reaching out to those other programs and services that they have just mentioned.
Okay, I'll open it up to the rest of the panel. Would anyone like to offer like first steps that we could do, that a teenager could, or any young person could take to access some support?
We have a lot of, we do have teenagers going to the libraries. And so I would suggest that you try to get to a library. If you can't get to a library, I'm going to talk briefly about another service that I didn't talk about, which is really, really important. Because although we have 29 libraries, we still have pockets in the 5-county region that we are not reaching. There's like over 100 small towns we're not reaching. And so we introduced about a year and a half ago, mobile services. We brought it back from the 1980s and we call it Anywhere Library. And Anywhere Library goes to the schools and the Head Starts and the senior centers and senior residences, like a residential home. It goes to the different tribes in the region. It goes to the YMCA, it goes to Cielo, it goes, it goes all over. And so Anywhere Library, again, you can find out more at trl.org. It's all there on that homepage. You just click on Anywhere Library and you'll see the default goes to Thurston first, so you can see the food banks and the churches and all the places that we go. So we do go to places where teens hang out, right? So the teens could go to some of, many of those Anywhere Library locations. And we do go to the middle and high schools too. So there is that. I would also strongly urge teenagers to go to their local library because there's so many, there's programs, there's staff who could support them. They will meet other teenagers. Some of our libraries have advisory councils that are teen advisory councils. Our board, like I just mentioned a few minutes ago, just approved the new strategic direction. Well, the third foci that we are focusing on in the next 5 years, and I'm super excited about this, is children, tweens, and teens. So expect a lot more from your local Timberland Regional Library and the whole district in the years to come for this group of people.
Awesome. What can other organizations do to help collaborate and support the work that you're all doing? How can we all get together and add our support to yours to make this even better for those who live in our region? And this is to anyone in the panel.
Well, Lori, I would like to put a plug in for volunteering generally and among teens. And also, volunteering is pointed out in the Surgeon General report as being one of the most effective ways to avoid social isolation and loneliness, because by nature, you're engaging with other people in some way. And we have quite a few teens actually over time and young adults who have volunteered at Senior Services. We're a really volunteer-driven organization. We have over 500 active volunteers with us doing all sorts of things, from delivering Meals on Wheels to working in our thrift store to serving coffee to doing more technical sorts of things, and in our kitchens. So you get your food handling card and you can volunteer to work in our kitchens making delicious, healthy food for seniors. So volunteering is something that I think that we should really emphasize throughout our efforts to help people of all ages stay better connected.
Thanks for sharing that, Brian. Does anyone else want to add their voice to this? If I were a volunteer and I wanted to get started, what would I do to help support, say, Department of Public Health and Social Services or United Way or the library? What could I do?
I think reaching out directly is a great opportunity of finding the spot that you're passionate about as well. So if it really resonates for you for literacy or seniors or teens, wherever that spot is, find the spot that makes sense to you. So I know as the resource development director that I'm always willing to have a conversation, have coffee, trade emails with folks. So if people are looking to get involved, we are always, I can speak for all of us, I'm sure, looking for volunteers, for resources, for more people to get involved, have the voice amplified. We really would love that. So reach out to us directly. Nearly all organizations are going to have a website, and you can go through that. I know that I'm happy to provide my information too, but contact us. Let's talk.
Thank you for sharing that. A number of years ago, I recall United Way, and I believe it was United Way, Lewis County, was working on an initiative for the 211 initiative, I believe it was. It was for just information around social services and supports and referrals. And does anyone on the panel know what happened to that? I know there was a grant-funded program and the funding ran out. And I was just wondering, does 211 still exist? Are there still social services? I mean, also all services available on that? My instinct tells me yes, but has it been updated?
I can speak for 211. It's become
Okay.
regionalized in a lot of areas. So it is funneled through Pierce County right now for Thurston County. So keeping that the services updated is something that we as service providers would need to do. So they don't have the capacity to reach out to everybody all the time, keep information updated. So in order for that to be, I think, an even healthier resource, we would need to come up with a little bit more direct reporting call, but for right now, it does function. You can call it from here. They can let you know about CYS or senior services, whatever the need might be.
So that would be a good place to start if you're just looking for some general information then.
Yeah, it's quite healthy.
Okay.
I also,
Jen, go ahead.
I also just added in the chat the Community Connections Care Guides, which is a
Oh, lovely.
very large resource for all things, many different topics. So that's a good place to start as well too.
Thank you for sharing that. Very appreciative. I have one or two more questions and then we can open up to the audience. I'm curious, as a former educator myself, how do each of you interact with the school system around providing your supports and referrals and resources with the school liaisons? How do you support students through the schools? And this is for anyone.
Well, I'll go since there's a pause. Okay, across the region, there's 44 school districts and one ESD, 113. Actually, there's 112 in Southern Pacific County, 114 in North Mason County. So we work with all 44 school districts. We either have staff going to them fairly regularly, or the teachers are reaching out to us. We also have, so we go physically to the buildings or they come physically to the library. We also have MOUs with 42 out of 44 school districts. So it's a memo of understanding between each school district and Timberland, so that all K through 12 students who are going to that school have an E number, a library card number in their Skyward software account to access online resources from Timberland's website for ongoing homework help or literacy needs or reading or whatever that's going to be. So and we encourage people to get a full library card as well. So we have the My TRL program. We have been partnering with the schools for many years around our summer library program because we know there's a big gap between the end of June or mid-June to September. So we have a summer library program that it's open to all ages. So it used to be very siloed, like children and teens and no adults. And then I don't know, it must have been a little bit before the pandemic, we started putting it all together. So we are reaching record numbers of people. Our summer library program has a lot of different programs going on throughout the region, also around STEM related, literacy related, and the venues are moving to outside now because some of these meetings or programs rather are bringing in 400 people, 500 people, and our libraries just cannot sustain that number of people in our meeting rooms or in the libraries themselves. So we do that. We also participate, we've been participating for the past 25 years with the Latinx Youth Summit. So this is all high school Latinx students from all 44 school districts who are bused in to a local college once a year to get that feeling of what it feels like to be on a college campus. And they have a whole day of programs and a keynote speaker as well. And that's been going on for 20, 25 years now. So those are a few things that we do with school age youth. Obviously, we're going to be doing a lot more in the years to come, but there's always opportunities. There's always more opportunities.
Thank you, Cheryl. Anyone else would like to add to that?
I mentioned our high school navigator, career and resource navigators program we have. We also have great partnerships with the Thurston area school districts. And as we look for further initiatives from that cradle to career movement, we are partnering with them, looking at what are the gaps, what are the needs. So more to come from United Way on that one.
Thank you. What about community-based organizations that you work with on a regular basis? I know that our county has quite a few, and some of them, they're all very specific usually, but I know it does take a village. So to what extent do you all interact and collaborate and partner with other community-based organizations to kind of expand your reach? Do you take referrals from others? Do you?
I'll start and say that Senior Services partners with various organizations in various ways. One of the organizations that you either know about it or you don't, which is easy to say, but it really is important, is the Area Agency on Aging. They are an organization that serves Lewis, Mason, and Thurston counties. And if you are a senior, 60 or above, there are all sorts of things that they can support seniors with. They are a separate entity. They're not part of our organization. They are an entity that receives federal funding and state funding to do case management and provide other supports for seniors. And of course, we work very closely with them because they are the pass-through entity that helps fund our Meals on Wheels program, our Brighter Days program. By the way, we operate the only day program in the county that is a day program for seniors with cognitive illness. So sort of mid-stage dementia, Alzheimer's, and associated diseases. We call it a respite program because the caregivers and for those family members, and many of our families have been touched by this, mine has, it's really an incredible burden if you can't leave your loved one alone, for example, if they're at risk of not knowing where they are or leaving the stove on or simple things like that that can be really dangerous. And so we operate this program called Brighter Days where you can bring your loved one and just during the day, and we provide an enriching environment, social connection. I read recently, there's a 2020 report on seniors by the National Academy of Sciences that being isolated and lonely increased the risk of dementia by 50%. And that's profound. I've not previously thought of dementia as being influenced by such things, but that's what the research shows. So if you have aunts, uncles, parents, grandparents, just taking this seriously and really don't let them, no matter how American they are and say, oh no, I'm fine. Really take it seriously if they're home alone every day and feeling lonely, to engage with the library or with senior services or the YMCA or whatever they like to do to stay active. So I just wanted to emphasize that here tonight. And actually, Lori, remind me the original question. I got thinking about those things and my mind wandered.
I was just saying, to what extent do you work with?
Yeah, we
other
partner. Yeah.
community-
So we partner with the food bank. We host food distribution from the Thurston County Food Bank in our senior centers. So the seniors just come, knowing that they can on that Thursday get a fresh thing of food. So we partner with them pretty closely. And we partner, I mentioned, with the Area Agency on Aging. And so I work closely with United Way, and United Way, of course, helps distribute some funding to us from locally and otherwise, especially during COVID. They were the pass-through organization for some of the COVID funding. So senior services, like many nonprofits in town, is highly web connected.
That's so important too, especially since the pandemic. I wouldn't say we've shifted completely back to in-person, but we're getting there. And it is kind of a nice, you have opportunities and options to do either in-person or virtual, which some people just can't access something in person all the time. So that's good to know. My last question has to do with our local legislators, our elected officials. To what extent do you think they're aware and maybe I'm just guessing, you may not know, but I'm just curious as to the extent that they're aware of and involved in, like our county commissioners, in supporting all of your efforts. I know Commissioner Mejia has been very, very involved in supporting the issue of social loneliness and isolation. I'm just wondering if I got that backwards. Sorry.
I'm looking at Jen.
Yeah, so just to clarify, all of 5 of the county commissioners sit on the Board of Health, who is the body that passed the declaration this evening. So they are all very committed. They determined, when our partners came and presented to the Board of Health, they are all very determined and committed to this work. At this very moment, there isn't, again, that whole funding stream sort of thing, but we are incorporating this work throughout all of the other grants and programs that we have. But did that answer your question? Yes, they're all.
Yes. Yes, I just wanted to know the extent to which they were aware. I mean, I would assume they would be very aware. Just, and also how much all of you, interact with them, interface with them.
Well, as public health and social service, we're interfacing with them daily. And they are very aware because they signed onto this campaign. And if you follow us on Facebook, which I put in the chat, you will see the photo of all the partners and all the commissioners together.
Oh, okay. I will do that. Thank you. Well, thank
Lori,
you.
I will speak up and say
Okay,
that
go ahead.
Senior Services works pretty closely with the city governments for various reasons, because we operate in the Olympia Center and the Lacey Senior Center and so on. And I work closely also in Tumwater. We do meal service and programming in Tumwater. And I've met with all three of those city managers and discussed this campaign, Isolation Loneliness. And you know, I have to say, in the last year that I've been working on this, I've yet to meet a single person that I bring this up who disagrees with it being a problem. No one disagrees. Everyone I've met with said, oh yeah, of course. I mean, they themselves might have had challenges with it, or their loved ones, or their family, and so on and so forth. So that's what I found among the electeds that I've spoken with, both the city managers who aren't elected, but the also city council people that I've spoken with, mayors and so on, that it's just like, yeah, absolutely, yes, it's a problem. Yes, what can we do about it? How can we help? And the drumbeat that I've tried to hit upon this year is that Senior Services didn't budget anything differently this year. We didn't budget anything differently, but just like Cheryl is doing tonight, and just like Jen spoke to, within our existing budgets, within our existing programs, we can highlight the health impacts of isolation and loneliness and help our community, more than anything, take it seriously. To not do what I used to do, which is just to think, oh, that's sad that Aunt Margaret was lonely. You know, I just kind of brushed it off as, oh, that was too bad. That was a bummer. But no. It's a very serious health impact, increasing chances of stroke, early death, and heart disease by 30%. And the risk of dementia, like I said earlier, by 50%. So, I mean, no one wants any of that to happen to anyone we care about or ourselves. So just people taking it seriously. And the electeds I've spoken with, I've had conversations with them saying the same thing, that they didn't budget anything differently, but they can put it in their newsletters. They can talk about it with their families. And I think that's powerful.
What a great... Go ahead.
It's very powerful. I wanted to add on because Kyle's not here tonight, so I don't want him to feel lonely and isolated when he watches this later and realizes that we didn't talk about the why. So he was not able to be here. Kyle Cronk is the executive director, and he gave me some talking points. And so here's action items that he would have shared if he had been here tonight. One is what we were saying all along: get involved in local programs, encourage people to participate at their local Y, senior services, library programs, community gatherings, workshops, classes that support social connections. Number two, be a social connector, which is what Elizabeth was saying. Inspire people to commit to reaching out to one person in their community who may be isolated. And they can extend a simple invitation to an event, share resources, or even schedule regular check-ins. Volunteering, dual benefit of enhancing the volunteer sense of purpose while connecting with others in the community. And again, you could be mentoring youth or supporting social services or visiting seniors. And lastly, he wrote about advocating for policies supporting social health. Encourage people to advocate for policies at local and national levels that support community-based initiatives, mental health resources, and funding for public spaces that foster connection. Engaging with local representatives can help amplify the importance of social connectedness as a public health priority. One of the things that we started to do this year, because we all know we live in a very cold and rainy climate and dark, is that we started to bring in indoor play structures, interactive play structures for young children or for children. And so right now, if you visit Shelton, Westport, Salcombe, those are the three that come to mind right now that have indoor play structures. When the Randall Library, when the Mountain View Library in Randall in East Louis County opens up January 11th, a brand new library, first one in 25 years, it will have a play structure as well. And so we see how important that is because we see the families come in with the kids and interacting with other moms, parents, dads, and other children. And so we see that on a regular basis. And Lori, I want to go back to what you asked about the partners. So the person who's helping us on the technical side tonight is Chris. And Chris has puts together with staff every year our partners list. And it's hundreds of partners across the region we partner with, from elected officials to community-based organizations to other educational institutions, et cetera, et cetera. So we have an up-to-date database that, or a spreadsheet that I do share out with new leaders coming in, or, you know, because I meet with a lot of executive directors from so many CBOs in our region to move the whole region forward. And then the last thing I wanted to mention is that, you know, you go to your library for more research around loneliness and isolation and for more ideas on how to address these topics. Because we do have databases that are very up to date with all this research.
And for those who can't remember any of that, just tune into the podcast on the YouTube channel on the Timberland Regional Library website. Does anyone from the audience have any questions that they'd like to ask our panelists before we move on? It sounds like there's a very clear call to action here. That yes, there is, we recognize the epidemic of loneliness and social isolation in our county and in our region. And yes, we have many, many resources to mitigate those feelings. And there are so many things that you've all offered, a wonderful array of things, and from getting involved to helping others to just reaching out and accessing websites, and even on your social media pages. So I want to thank all of our panelists for providing this amazing and very important information and all the resources you have. And thanks to all of you for all the hard work that you engage in that can help prevent this continuing epidemic. Several years ago, before COVID, I recall a campaign of hope that was going around our entire region, especially in Thurston County. And we had so much data around the facts about having hope and being able to counteract adverse childhood experiences, and any other kind of experiences that people were suffering. And it coming out of the pandemic, it feels like we're back on that track again, which gives me hope. So thank you to all of you for all the information and resources you've offered. I'm going to turn it over back to Cheryl to finish us out tonight.
Great, thank you. So one last call for any questions. Okay, so this recording, so thank you for attending, and this recording will be available most likely tomorrow on Timberland's YouTube channel, which is just at the bottom of every landing page on the website. And I'm sure the Capital STEM Alliance will have it on ESD or your own website, and then we'll send it out as a recording to Thurston County and to Senior Services and to the Y and to United Way. So everybody's going to have it to share out with more people. As Lori mentioned at the beginning, I saw a need across this region coming out of the pandemic, a need for to come together across 7,000 square miles to talk about human-related issues. And the first one we put on was around mental health. And then the second one was on school attendance. And we always bring in local subject matter experts to come in and talk about the topic. We had one on childcare earlier this year. And so we will be doing 2 more next year. We don't know what those topics are yet. If you do have suggestions, please share them. And please share what you've learned tonight with people, because it's like we said at the beginning, at the outset of this program, it's going to take all of us to move the needle forward and to address these really deep societal issues. So, does anyone else want to close out besides me?
I would love to thank you, Cheryl, for hosting these conversations for our community. And this one in particular tonight, just fantastic. I want to thank Lori for facilitating this motley crew, this herding the cats, so to speak, and everyone for again attending, because it's a choice to spend some time with us tonight. And I hope both reflects and shapes your thinking about how isolation and loneliness affect our health and the health of our community. So I'm reminded of that joke that how do you tell the extroverted Norwegian? He looks at your shoes when he's talking to you. You know, we do live in a place that is challenging. I was vacationing this summer in a warm, actually it was in the fall, in a place that's warm year round, and the culture in those kind of places is an outdoor culture. They eat outside year round. They're just out all the time because it's year round, and that's not where we live, and we love where we live, but we have to make an extra effort. It takes an extra effort to not be alone in your house here, because you have to go to a building someplace, because you're not going to be hanging out outside so much unless you're skiing or something. So go to the library, come to senior services if you're 60 or above, go to the YMCA. It's just, I couldn't, we have great resources and great opportunities, and it's up to each one of us to do ourselves and encourage our loved ones and friends to take advantage of these things. So thank you, Cheryl, for the opportunity to speak about this.
Thank you to Chris for the technical assistance tonight, and thank you to Lori as being a great host this evening. Thank you all the panelists, Dr. Jen, Elizabeth, Zach, and also to Kyle, who couldn't be here tonight. And the comments are, thank you all for sharing this. This was wonderful. This is the first great step to many more, truly invaluable. Thank you all for your work. Thank you so much to all of the presenters, such invaluable information. And who knows, we might have a follow-up, right, in the future. I mean, to just say, have we moved the needle on this?
I think that's a great idea.
And we need to look to Dr. Jen for those metrics, but and we could look to ours also for metrics, because we keep how many people use this, that, and the other, so we can certainly share that out too.
And Cheryl, I would like to add to the audience, if any of you think of topics, if you know of topics that are at the top of your list that are such as social isolation and loneliness, please let us know. We like your suggestions, and we can use that as our theme for our next Moving Forward Together, which will be next spring.
Yes. And who knows, we might ask you to be on the panel, depending on what you do. Okay, on that note, we end a little bit early at 6:45 p.m. Thank you so much for coming. Thank you to our panelists, and we shall see you at the library, at the Y, at Senior Services, at United Way events, and at Thurston County programs. I think I got everybody. Yes, I got everybody. So thank you. Have a good night.